In this study, the Delphi technique was used to investigate the use of hydrogel rectal spacers during radiotherapy when treating prostate cancer. The goal was to identify a consensus on patient prioritization for rectal hydrogel spacer use during radical radiotherapy for the treatment of prostate cancer in the UK. Before discussing how the study was carried out and what was found, let's start with the most important part, the why. Prostate cancer in the United Kingdom. Prostate cancer is the second most common cancer found in men globally and the most common cancer in men in the UK. About 1 in 8 men in the UK are diagnosed with prostate cancer in their lifetime, with over 47,500 men diagnosed every year. Thanks to the hard work of healthcare professionals and researchers, the 5-year survival rate for localized prostate cancer in the UK is almost 100%, with over 70% of men with prostate cancer in the UK surviving for 10 or more years. Due to the high likelihood of curative therapy, a key treatment goal is to prevent potential adverse events from impacting patient quality of life after treatment. Treating prostate cancer. Choosing the right treatment for prostate cancer is complex due to the many different factors that must be considered. Factors include cancer stage, risk stratification, life expectancy, and comorbidities, as well as other patient-specific factors such as lifestyle, patient preference, and treatment goals. Radiotherapy is a well-established and highly effective treatment for patients with prostate cancer, but like most treatments, a patient who has been directed towards radiotherapy will potentially suffer from side effects due to radiation. Due to its proximity to the prostate, the anterior rectal wall is vulnerable to radiation-induced toxic effects, which can cause gastrointestinal complications. Long-term effects of radiation toxicity, such as urinary and bowel incontinence, remain problematic. A study conducted by the NPCA found that 1 in 10 men experienced a severe gastrointestinal complication after radical radiotherapy within 2 years of treatment. This is where rectal spacers such as hydrogel come in. What are hydrogel spacers? Hydrogel spacers can reduce rectal toxicity during radiotherapy for prostate cancer. They work by increasing the space between the prostate and the rectal wall. The hydrogel spacer's ability to significantly reduce late rectal toxicity severity was demonstrated in a single-blind Phase 3 trial in 2015. At a 3-year follow-up, a reduction in bowel toxicity and fewer declines in urinary and bowel quality of life were observed in the spacer group. Unfortunately, due to financial constraints, patient access to hydrogel spacers is limited in the UK. That's why experts set the goal of understanding which patients should be prioritized for their use and explored this using the Delphi technique. Method. The Delphi technique is a structured, multi-stage process that gathers opinions from a panel of experts using rounds of questionnaires. These opinions are then synthesized into consensus statements. The Delphi study utilized a 5-step approach through which 7 expert urologists and oncologists answered several questions. All healthcare professionals involved in the study were experienced hydrogel spacer users. To ensure diversity, the experts were from different areas of the UK and used different types of radiotherapy modalities in their practice. The experts on the panel were Heather Payne, Amit Bal, Sunil Jain, Clive Pedal, Albert Edwards, Andrew Thomas and Prantik Das. There is no perfect panel size for a Delphi study, but an odd number of experts were chosen to ensure that a majority outcome could be reached. The 5-step approach consisted of 2 pre-advisory board questionnaires administered via a web-based survey program, 2 virtual advisory board discussions, and a final concluding questionnaire. Questionnaire 1 provided background information on the experts, including their most used radiotherapy modalities and open-ended questions to capture a broad understanding. Experts were asked to rank treatment modalities in order of how much patient benefit they would expect from hydrogel spacer use on a scale from 0 to 1, where 0 represented no patient benefit and 1 represented maximal patient benefit. Questionnaire 2 presented the responses to the open-ended questions from the first questionnaire, and the experts were asked to rank them in order of importance. In addition to follow-up questions, this questionnaire included questions on perceived barriers to hydrogel spacer use. All 7 healthcare professionals inputted towards the final consensus statements and were asked to select a level of agreement from "I fully agree", "I partially agree", and "I disagree". It is worth mentioning one expert did not complete the second questionnaire but participated in all other steps. Analysis. Qualitative content analysis was used to analyze open-ended questions. 2 researchers also analyzed responses and interpreted consensus from the responses to the questionnaires. This was done separately to reduce bias. Based on the results of the final online survey, statements were categorized into 4 levels of consensus: strong, moderate, low, and no consensus. Only statements grouped as either strong or moderate were considered statements where consensus was reached. Weak or no consensus meant that there was still substantial discussion or divergence of opinion among the experts. Results. Most experts in this study agreed that hydrogel spacers reduce post-radiotherapy rectal toxicity of any grade. The panel reached a consensus on the importance of minimizing toxicity for treatments with curative intent and agreed that even low-grade toxicity-related adverse events can significantly impact the quality of life. However, the panel also estimated that an average of 83% of patients who could potentially benefit from a hydrogel spacer were denied access. The panel reached a sufficient consensus on 10 statements. 1. Curative treatments should aim to minimize toxicity and risk of side effects. 2. Spacers significantly reduce rectal radiation dose and toxicity-related adverse events. 3. Too many patients experience rectal toxicity despite meeting rectal dose constraints. 4. Certain grade 1 toxicity-related adverse events can significantly impact a patient's quality of life in the form of bowel frequency and urgency, diarrhea, flatulence, radiation cystitis, radiation proctitis, rectal bleeding, and rectal mucus. 5. Patient-reported outcomes should be considered alongside a grading system-based toxicity evaluation. 6. Spacer use should be considered in eligible patients receiving long-term anticoagulant therapy, for example, direct oral anticoagulants, who can safely pause their anticoagulation. 7. Spacers are beneficial in patients with T1, T2 disease. In patients with higher grade tumors, the benefits of spacer use should be evaluated on a case-by-case basis by a team experienced in spacer use. 8. Patients should have the opportunity to participate in the discussion around spacer use. 9. Eligible patients with certain comorbidities such as anticoagulation, diabetes, inflammatory bowel disease, including ulcerative colitis and Crohn's disease, and/or longer expected overall survival, are likely to benefit more from spacers. 6 out of 7 of the healthcare professionals fully agreed with this statement. The partial vote suggested changing the statement to just "eligible patients with certain comorbidities are likely to benefit more from spacers." 10. All eligible patients undergoing radiotherapy should have equal access to spacers, independent of socio-economic factors. 5 healthcare professionals fully agreed to this statement and 2 agreed partially. While there was an overall agreement that lack of quality in access to spacers is an important issue, of the 2 partial votes, 1 proposed adding more detail to the statement on eligibility and that patients should have access irrespective of their financial situation. The other expert expressed uncertainty regarding the term socio-economic factors and prefers the term irrespective of postcode. The statements with the most notable consensus can be broken down into 3 categories. 1. Patient care and quality of life. Curative treatments should aim to minimize toxicity and the risk of side effects. The panel considered toxicity a considerable issue and underlined that also low-grade toxicity-related adverse events may significantly worsen patients' lives. One expert said, "I asked them, my patients, when you're out and about, is the first thing you think of where the toilet is?" And a remarkable number of patients say yes to that question, and it is affecting their quality of life. 2. Radiotherapy and toxicity, adverse events and toxicity. Spacers significantly reduce rectal radiation dose and toxicity-related adverse events. Unfortunately, because of funding limitations, patients need to be prioritized for spacer use. In the first questionnaire, the panel estimated that an average of 83% of patients who could benefit from a hydrogel spacer were denied access. Throughout the discussion, patient access in general and equal access were central themes. The main barrier to hydrogel spacer use was funding and resource constraints, followed by a lack of trained staff. The ideal situation would be to offer spacers to every eligible patient, but given that this is not always feasible, there needs to be a process of categorization. In my private practice, every patient gets it, hydrogel spacer, unless there is a reason why they should not get it. Whereas in my NHS practice, unfortunately no patient gets it, unless there is a reason why they should get it. The main barrier to hydrogel spacer use was funding and resource constraints, followed by lack of trained staff. The ideal way to go would be to offer it to every eligible patient, but given that this is not currently feasible in our centre, there has to be some kind of categorization. 3. Patient selection. Spacers are beneficial to patients with a range of conditions such as comorbidities, cancer stage, localization, and heavy smoking. This was narrowed down in subsequent discussion with general agreement that patients with certain comorbidities or on anticoagulation may have higher benefits from hydrogel spacers. Spacer use should be considered in patients receiving long-term anticoagulant therapy, for example, direct oral anticoagulants, who can safely pause their anticoagulation. This excludes patients with a cardiac stent or prosthetic valve replacements. Other patients who should be considered to benefit more are those with diabetes or inflammatory bowel disease. Spacers are beneficial in eligible patients with T1, T2 disease. Patients with higher than T2 grade tumours should not be excluded. The benefits of spacer use should be evaluated on a case-by-case basis by a team experienced in spacer use. Eligible patients with certain comorbidities and/or longer expected overall survival would likely benefit more from spacers is relevant here too. Due to access being unequal, these patients who could benefit are not guaranteed to be offered hydrogel spacers during treatment. Therefore, the experts believe patients should be evaluated on a case-by-case basis by an experienced team.